and welcome to our presentation. I am Dr. Kari Carstairs, clinical psychologist and psychoanalyst in private practice in London. Today, I'm talking to Jason Smith and Carl Gacono about the supplementary booklet that accompanies the CS-R. So that's a little introduction to our two speakers today, and I'm glad they're with us. What I'm going to be doing is asking Jason to give us an outline of the supplementary booklet, and then Carl will tell us more about the aggressivity cluster that is contained in this booklet.
Okay.
So we'll start with you, Jason. Please tell us a bit about why the CS-R has a supplemental booklet.
Okay, so obviously when Exner created the comprehensive system and now the comprehensive system revised, the variables in there are very good at assessing patients. However, there are some good supplemental scales that people use, clinicians, researchers, such as the Rorschach Oral Dependency Scale, the Gacono and Malloy Aggressive scores, that can add more to the clinical understanding of a patient. So we wanted to provide a booklet for people that are interested in these different scales, which I'll talk about, to give them a way to score them reliably, all kind of have all information in one spot that would be helpful for them.
Right. So it's like a sort of consolidation of this extra work that has been done.
Exactly. Yes. Yes. With different chapters with different authors contributing.
Right. Okay. And who has been working on this booklet? Who are the main people who've been involved with this?
So myself, Patrick Fontaine, and Yifat Weinberger are the editors of the book. So we were kind of overseeing everything. And then in the different chapters that we have, I'll go through the different topics. So in the chapter for the Rorschach Oral Dependency Scale, Yifat and Robert Bornstein are working on that chapter. Carl and myself worked on the Gacono and Malloy extended aggression scores, and he's going to talk a little bit about his aggressivity cluster as well. The mutuality of autonomy scale, Chris Fowler and one of his students, Natasa Johnson, is working on that chapter. Myself and Carl are working on the Cooper, Perry, and Arno Rorschach Defense Scale chapter. Mm-hmm. We have Anna Marie Rosso working on her extended space scores. We have Shira Tibone working on her reality fantasy scale, the RFS2 scale. And then we have John Stokes and David Pogue, who are working on the ego impairment index.
Great. Sounds like a great team and quite an international team, if I may say.
Yes.
So. Yeah. Okay. So you've started to give us an overview of what's in the booklet. Mm-hmm. Can you say a bit more maybe about how it's structured, the format of it, and what it adds to the CS-R?
Yes. So each chapter will have kind of a background information about the scale. It'll include reliability and validity and any new current research with the scale. And then the main kind of point in there is how to score it reliably and then interpret the scale, how clinicians and or researchers can use it. And then it just adds to the CS-R, just giving more options to people. I think that's always good to, if they're flexible or they want to learn something new and add to the CS-R interpretation.
Right. So it sort of helps the clinician to hone in on something that's of particular relevance to the case.
Yes,
right.
I would say so. Yes.
Right. And if I understood you correctly, when you use the chess, then you automatically get these scores if you put it into the program, or how does that work?
Yes, you'll be able to score them based on the interface, that they will be options for you to score them in the program. So there's no, it's anything you have to add on or anything like that. If you choose to use them, great. If you don't, it's not required that you score them.
Mm-hmm. Mm-hmm. Okay. Is there anything else you'd like to say? I think you've given us a good overview, but is there anything else that we would need to know to understand what this booklet offers?
Nope. Again, we're working on the chapters. We hopefully have it at some point this year. shooting for July to release everything for the
Our
book.
Congress, yay!
So we are working diligently, finalizing everything. We're doing our best for that. I'm going to kind of set up Carl, but one of the big innovations, not only in the booklet will we be talking about, is this new edition of the Gacono Aggressivity Cluster, which I'll let Carl kind of talk about, but it really is a great addition to start looking at how we can start conceptualizing a patient's aggressivity.
Okay, well, great. Thank you so much, Jason.
Yeah.
So let's go to you now, Carl, and maybe you could start with describing the development of the Gacono and Malloy extended aggression scores.
Sure. Gary, I want to say, first of all, I'm very excited to be part of this project. The work that Jason and Ann and Patrick have done with revising the comprehensive system, it's one of those things you feel fortunate that it's happening in your lifetime. So, I mean, the work that Patrick and everyone's put in has been just phenomenal. So I'm glad to be a small piece of that. It's kind of like there's experiences in life, like if you collected comic books to see these things come out in the Marvel movies. You've lived long enough to see that. You feel like your life's complete. That's how I feel about what they're doing here with the comprehensive system revised. But let me start out with these aggression scores, because these were the interest in them really began in the 1980s when Tom Heaven and I were doing our dissertations. And Tom was interested in the Exner scoring. So he looked at aggression, and one of his predictions were the psychopaths would produce more aggression than non-psychopaths. Well, we came up and found out that wasn't the case. In fact, they found less. In the process of us administering the protocols and interviewing these inmates, what I noted was they produced a plethora of all kinds of other aggressive imagery and interesting kinds of responses. They wouldn't just produce a woman that's had an injury. They produce a woman that had her head blown off, which is aggressive past. They put the aggression in on the Rorschach, but in different ways, and were measured by aggressive movement with the Exner system. So I observed these kind of things, and I began to record them and quantify differences. At the time, Reed Malloy happened to be a dissertation chair for both myself and Tom. So I'd go back with Reed and tell him what I was finding, and we discuss these things and think about them as to what they could possibly mean and what they symbolize. Some people have brought up the idea of conscious censoring, why aggressive movement was not produced. Well, they failed to explain the idea that these individuals during the interview would boast about their aggressive behavior. Yeah, I jacked this guy up, I did this or that, I assaulted that person. And there was bravado and identification, particularly with the psychopaths, about those behaviors. So why would you censor aggression on the Rorschach? And then why would you then not censor aggressive past, aggressive content, and the rest of the scores? And some of the literature suggested that certain Rorschach variables that had to do with perhaps shading at times would be produced. For instance, texture might be produced in these kind of individuals because the person had a fearful kind of attachment, or they had an unpleasant relationship with whatever was being produced. So my thought at the time was, given this data and the other studies that had been done, is I wonder if it had something to do with tension. In other words, the psychopaths had no tension in producing aggression and talking about aggression. I mean, they verbally, openly, freely discussed it, versus neurotic people and normal. Well, if any of us have worked with folks in therapy, we know that one big factor people have is problems with aggression. They turn it inwards. It turns into guilt and shame. They have difficulty expressing it. So the hypothesis then became that the psychopaths did not produce aggressive movement because it was not conflictual to them, or kind of neurotic and non-patients do. And since that time, all the research, good research and sound methodology, has really supported that contention. Now, remember, I'm just saying about aggressive movement. The other things fall into different categories.
Yeah.
And so all kinds of people can produce those in different populations.
Well, thank you. So how does the Gacono Aggressivity Cluster differ from these extended aggression scores and from, let's say, a Rorschach aggressivity constellation? What's new about this cluster?
the idea that the aggressive imagery and the aggressive scores capture certain things like preoccupations, focus, and identifications. But any of us have done any risk assessment and actually done any clinical work know that when you assess the risk of future violence and danger, you look at both dynamic and static factors. So it's a much more complex issue than just the idea of how does the aggression function within the personality, what defenses, constellations revolve around it, and so forth. It's a much broader issue. So an affectivity cluster and clusters on the comprehensive system, the structural summary, really have to do with giving you a picture or a one-shot template for understanding factors that would contribute to certain types of behaviors or issues. Self-perception, for instance, with morbids and reflections. Constellations differ from that as you're really looking at predictive things. If it's greater than 4 on DEPI, does this mean something, or does this increase the likelihood of someone having an actual problem with depression? The same thing with the CDI and the suicidal constellation. So the aggressivity cluster is not meant to be predictive of future behavior.
I see.
It's meant to provide a description of what kind of things contribute to that behavior. For example, if you have an individual that has a past history of violence, and you want to look at the aggressivity cluster, you will see the kind of dynamic personality vulnerabilities that contributed to that behavior occurring. Or if you want to look then at the future behavior, the cluster will let you understand that should a violent behavior occur in the past, these are the kind of things that probably contribute to that or let that happen. Now, for a clinician, the power of that is if we can understand vulnerabilities and things, certain things are dynamic and changeable within the person. So that means we can address our treatment to those kind of issues. So the aggressivity cluster gives someone, here, let's look at this and let's see what kind of factors we may want to target for intervention, medications, or to describe the individual's potential for acting out. But it does not predict future behavior.
Right. I see what you're saying. That's very helpful. That's really interesting. How did you arrive at the GAC components?
Well, I forgot to mention one thing, but I'll mention at this part. If it wasn't for Jason's help, in the supplemental book, he did an extensive lit review on all the aggression scores and all the research that's been done. Jason is I don't know if the people in Europe remember James Rockford and the Rockford files. Well, if you give Jason, he was a detective. He bumbled through things. He'd get punched. He'd do dumb things. We could all relate to him as a human being. He was very likable. But anyway, if you give Jason something to do, he can usually find it. Now, I know he has these methods for finding. He never tells me because he wants to appear mysterious and omnipotent with it, but he can find anything. So he did a lit review based on what things in the literature in the past have been related to acting out in aggression. And then I had some of these articles from my dissertation, but he did an extensive lit review. Must have been over 40 articles. So we went from Jason's work there and supplying me with these. And then, given my knowledge of risk assessment and predicting aggression and looking at that sort of thing, I went through these articles one by one. It took about 4 months. And what I did is take careful notes of the kind of things and the cutoffs and such that were found in the literature that correlated with violent behavior and were associated with it. That's how I arrived at the components. And I can say at this stage with the 3, there's basically 3 components it was narrowed down to. Well, you can see in section 1, it has to do with controls, lability, and impulsivity. And you can see some of the variables and things that go into that particular constellation. I developed some new things such as aggressive sum 6, looking for aggression responses that had severe cognitive slippage in it. Or W sum, well, not color sum 6, looking for those color responses, which was one thing in the literature that was heavily correlated with different kinds of acting out. We all know about the impact of lambda in the literature. High lambda folks usually get overwhelmed in situations and don't have the skills for dealing with potential emotional situations, including those that involve aggression. Low lambda is too overly involved and gets sucked into it.
That I can see the 3 main areas. It's like the controls, the orientation towards others, and then the aggressive preoccupation and the drive. And then underneath that, you've got these different variables. So it's very clear the way it's laid out here.
Well, this is a lot of help from Patrick, too, on organizing this. I'd give him all the information, and he did this somehow. I don't know how he did it, but yes, the orientation to others, one of the things in the literature is if you devalue others and have these derogatory perceptions of others and so forth, you're more likely to dehumanize them. And you can see some of the variables that go under that. And you also notice in the footnote that other things that I think will probably be included in this have to do with splitting, devaluation, projective, and projective identification, because all these suggest distorted views of others. And then the final area, this is where the aggression scores fit in. Aggressive identifications, preoccupations, and the amount of drive. I developed this idea of the destructive, well, the DLC, which having to do with explosion, fire, sex, anatomy, and XY. Certain of these variables have been included in other areas of the Rorschach, but these in particular were also related to acting out against others. So it's the idea, if you have these reduced controls, you're labile and impulsive, you have a devaluative, derogatory, distorted perception of others, and then you have all this aggressive drive and preoccupation. You can see this forms the template for acting out against others.
Yeah, it makes sense clinically to me. Yeah, I can see what you're saying.
Yeah, it's like a lot of things. It has face validity.
So how would a clinician use the GAC to understand an individual? Looks like you've got a case example here. Maybe you could talk us through that a bit.
Let's say we get a guy that comes in, it's a parole assessment, and he has a couple history of assaults in his record, and each of his assaults were done where he was under the influence in a bar. Well, we look at his Rorschach, and he's a non-psychopath, and he has some of these features. Obviously, if we get him into substance abuse treatment, he's no longer drinking. If we keep him out of bars, if we do a lot of kind of skill building kind of therapies and cognitive work that can help with different strategies for managing that, you can see gradually we're helping the individual gain the skills and shaping some of the dynamic factors that will reduce the likelihood of future behavior.
You'd also hope that the D of -1 would come up to a D of 0.
See, I've had pre and post tests of inmates going through therapy. They tend to produce then more M, less cognitive distortion. You know, we've all seen this through clinical work. So yes, just like you're saying, you would hope often the Rorschach and the changes of the Rorschach are reflective of what's happening with the patient or client. These Heimland paranoid schizophrenic antisocials. Well, we didn't want to bust down their defenses and attempt to lower the lambda right away, because then they would begin to have a psychotic break or disorganize. We wanted to respect that high lambda idea and gradually ease into things and make things more manageable. I used to do a lot of parole assessments for the or conditional release assessments for folks that were in the state of California. And often the therapist would say, I'm having trouble with this patient. He's beginning to decompensate. I'm having trouble with this patient. You could look at their Rorschachs. You could understand the therapist and how they interacted. Let's say you have a feelings-oriented therapist with a high lambda paranoid schizophrenic, and you could see why they were decompensating. So it's this kind of idea with the cluster. The clinician can go right to this specific cluster and get valuable information about this particular issue.
Yeah, I see. It really helps in treatment planning. Yeah, I can see that. Thank you. As our last discussion point, what further research would you like to see with the extended aggression scores and the GAC? What particularly would you like researchers to be working on next?
Well, Jason and I talk about this in the chapter. With the sadomasochistic response, it's not produced that often, but I have introduced two other kinds of ways that may be fruitful of measuring sadism on the Rorschach. One is projective sadism, where the person, for example, looks at the card and says, it's an angry guy and he's smiling. He's about to hit you. So, you know, he isn't doing the traditional definition where he says some sort of devalued, aggressive or morbid content and laughs. He's putting it right onto the card and interacting it in the relationship with the examiner. Another one was a guy that said this would be a form of not so much projective, but projective attribution. with the sadism, sadistic attribution, where he looks at the card and he says, well, it's like a fly with its wings pulled off. When I was young, I used to like to pull the wings off of flies. And then he creates a personal. He's attributing the sadism to himself in a behavior that he's expressing on the card. So that's one area. Another consideration, of course, is gender and all the work that Jason and Ted have done with the females. These rather interesting findings that are consistent with theory, but you have to consider gender because these findings are also somewhat different. And then really the third consideration is high lambda samples. We look at these meta-analysis that Jason and Ted and I have criticized, they don't control for that and they include everybody into the same thing. So when anyone approaches the research, Jason and I talk in this chapter about 5 considerations that they need to think about and look at. All the aggression scores can use much more work. I have to think specifically about the kind of things that would be most interesting. Certainly cutoffs. The work of Beatty and his colleagues on finding some cutoffs. They established some cutoffs for aggressive movement and also aggressive content. This is a good, fruitful direction to go in. Let's see what that looks like. As far as the aggressivity cluster, well, the whole thing needs research. Which are the most fruitful variables to have in there? Should some be added? I think it's a very nice skeleton and it has some meat on it, but it's certainly not complete or finalized.
Well, that's great. It's really exciting. I'm really looking forward to seeing it all come together, and I'm hoping we can all meet up in July and get to see what happens with this CS-R. It's really very exciting. Thank you so much, both of you, for giving us your preliminary thoughts, and we're really going to look forward to learning more when the booklet comes out. So there we have it, an overview of this supplementary booklet. We hope it's of interest to the Rorschach community. And we're now going to put up an email. If anyone who's watching has any questions or comments, please do email and you will get a response. We want to hear what you have to say. Thank you all very much.
Thank you, Gary.